Parent-Child Interaction Therapy by Josh Etheridge, Pam Drake, and Kara Dolan.
What is parent-child interaction therapy?
Parent-child interaction therapy is also known as PCIT. It is an evidence-based practice primarily used for children between the ages of 2 through 7 years old. PCIT can be completed within 12 to 20 sessions, but is not time-oriented. It is also used for children displaying behaviors such as aggression, defiance, argumentative behavior, and tantrums. PCIT is designed to improve relationships between parents and children through interactions.
History of Parent-Child Interaction Therapy.
PCIT therapy was developed primarily by Sheila Iberg in the 1970s. Iberg incorporated techniques from play therapy and behavioral therapy in the beginning stages of development. Iberg based PCIT on Diana Baumrin's developmental research work on authoritative parenting styles. PCIT also enhanced the work done by Constance Hanff regarding the two-stage behavioral program to train mothers with developmentally disabled children.
Description of the phases in parent-child interaction therapy.
The first phase of treatment focuses on establishing warmth in the parent-child relationship with the child through learning and applying skills proven to help children feel calm, secure in their relationships with their parents, and good about themselves.
The second phase of treatment will equip parents to manage the most challenging of their child's behaviors while remaining confident, calm, and consistent in their approach to discipline. In this phase, parents will learn proven strategies to help their child accept the parent's limits, comply with directions, respect house rules, and demonstrate appropriate behavior in public.
So why should you choose to go with parent-child interaction therapy?
The first phase increases the following behaviors: and feeling of security, safety, and attachment to the primary giver, and attention span, and self-esteem, and pro-social behaviors such as sharing and taking turn. The first phase decreases the following behaviors: frequency, severity, and or duration of tantrums, activity levels, negative attention-seeking behaviors such as whining or bossiness, and finally, parental frustration.
The second phase increases the following behaviors: compliance with adult requests, respect for house rules, improved behavior in public, and parental calmness and confidence during discipline. The second phase decreases the following behaviors: frequency, severity, and or duration of aggressive behavior, frequency of destructive behaviors such as breaking toys on purpose, and defiance.
Major concepts of parent-child interaction therapy.
It's also important to note some of the important acronyms for PCIT therapy. The first acronym is PRIDE, which stands for praise, reflect, imitate, describe, and enthusiasm/enjoyment. The second acronym is PDI, which stands for parent-directed interaction. Our final acronym is CDI, which stands for child-directed interaction.
Here is a demonstration of the parent-child interaction therapy.
The following video is a mock demonstration of parent-child interaction therapy, otherwise known as PCIT. PCIT is a well-known, empirically based practice intervention for families experiencing discipline and behavioral issues with children's ages 2 through 7. In this hypothetical case, the child is a 7-year-old girl named Sarah. Sarah's parents, Mr. and Mrs. Smith, have had difficulty managing Sarah's behavior for some time, and the situation has been getting worse since the family recently moved, and Sarah has begun attending a new school. In previous assessment sessions with the therapist, an unhealthy and an abusive pattern has been uncovered between Mr. and Mrs. Smith and Sarah. Although Sarah is slightly in the upper end of the normal age for PCIT, the family has agreed to try the technique suggested by the therapist. In the initial scene for which follows, we shall demonstrate the first stage of PCIT, called Child-Directed Interaction, or CDI. Watch as Ms. Smith is asked to use the PRIDE skills during this scene. PRIDE stands for praise, reflect, imitate, describe, and enjoyment. So Ms. Smith, I need you to come closer to Sarah at the table. Sit a bit closer to Sarah and please put your phone away. Once you're closer to Sarah, I need you to explain that this is a special playtime and that she can play with any of the toys that she wants.
Okay, Sarah, this is your own special playtime. You can play with any of the toys on the table.
Ms. Smith, I need you to use all of the Pride and CDI skills that you've been practicing while you've been following along with Ms. Smith to play.
What are you doing, Sarah?
Try to avoid asking questions, Ms. Smith. So I hear some toys, Ms. Smith. You should probably try to stop that and engage with Sarah.
Stop slamming the toys.
Okay, I need you to try to avoid criticism as well.
Sarah, keep the toys on the table. Damn it, Sarah. Stop.
Avoid comments, Ms. Smith, and try to avoid using swear words.
Sarah, you have to listen to me.
Ms. Smith, try using your pride since Sarah's moved away from the table. If you're going to ignore this behavior, I need you to take a calming breath and remember your pride skills while ignoring Sarah's behavior. You need to start playing with the toys and explain the fun that you're having. Just try to take a few deep breaths and you can start playing with the toys and describe the fun that you're having. So Ms. Smith, use your words so that Sarah can hear you describing the fun that you're having while playing with the toys, and eventually she'll come back to the table.
Okay, I'm building a wall out of Play-Doh. And now I'm going to build some cars out of Play-Doh, and the car is going to knock down the wall.
Good. Keep explaining the fun that you're having.
This is so much fun. It's just like out of a movie. The car is going to knock down the entire wall. Then I can build more cars and make a racetrack.
So once Sarah starts playing with you appropriately, thank her for playing, but wait for her to act appropriately as well.
Thank you for coming back and playing with me, Sarah.
Nice job, Ms. Smith. So as the session continues, the therapist was able to guide Ms. Smith to appropriately interact with her daughter and increase positive support and communication. Notice Ms. Smith's implementation of the pride skills and the positive reaction from Sarah. So with this parent-directed interaction, if you want to explain to Sarah how the session is going to go.
Okay, Sarah, this time we're going to play the game that I pick. So first, let's start with the wall and build the racetrack in the middle. And let's remember to keep all of the Play-Doh and toys on the table and to play gently and to put everything back when we're all done.
Okay.
So Ms. Smith, that was a very good way of keeping the rules simple and specific. You were polite in how you explained the rules to Sarah.
Sarah, you're doing a good job setting up the wall.
Nice. Strong praise, Ms. Smith.
So, do you want the cars on this side?
Yeah, let's put the cars on that side and then we'll have the starting line on that side.
So once the parent and the child have developed a stronger bond and the parent has mastered the CDI portion of the therapy, the next stage can begin. The second stage, called the parent-directed interaction, or PDI, involves teaching the parent how to effectively give the child instruction and utilize non-abusive forms of discipline when the child disobeys. Note how the parent incorporates the pride skills into this stage as well. Therapy will emphasize the commands that are direct, specific, positively stated, polite, given only at one time, given only when needed, and accompanied by a reason that either immediately precedes the command or accompanies the praise for compliment learned during the CDI component.
You're doing a really great job setting up the racetrack, Sarah.
Yeah.
Can you help me finish up the rest of the cars?
Yeah.
Good praise, Ms. Smith.
Which car do you think will win the race?
I think that one's going to win.
You think that one's going to win?
Good reflection.
Yeah, I think it looks the fastest.
Sarah, can you pick that piece of Play-Doh off the floor?
In a little bit. I want to keep playing right now.
I know that's what you want to do, but can we pick the Play-Doh off the floor to make sure no one steps on it? I don't want it to get stuck to the carpet.
Good job, Miss Smith. That was a very good way of accompanying the request with a reason.
Sarah, remember last week when we had to go sit in timeout? I really don't want you to have to go to timeout again.
Yeah, okay.
Thank you for listening to me.
Very good, Miss Smith. I like how you praised Sarah. So at the conclusion of a typical 12-session PCIT therapy, the parent and child will have developed a much stronger bond and an effective means to handle discipline if necessary. The goal is to teach methods the parent and child will continue to use throughout their lives.
Training requirements needed to become a certified parent-child interaction therapist.
The next component that's being covered is what it takes to become certified in PCIT therapy. The first would be a master's degree or higher in a mental health field. You may also be independently licensed in mental health service provider or working under the supervision of a licensed mental health service provider. Additionally, you may be a psychology doctoral student, has completed their third year of training and conducting clinical work under the supervision of a licensed mental health service provider. It should also be noted that you may receive PCIT training before the completion of their master's degree. However, they cannot be certified as PCIT therapists until their master's degree is completed or until they have completed their third year of their doctoral training.
There are 3 different types of training you can do to complete your PCIT certification. You can choose between doing 10 hours of online training from a program endorsed by PCIT International and 30 hours of face-to-face contact with a PCIT Level 2 or Master Trainer. You can do 40 hours of PCIT training with a PCIT International Level 1 trainer using a combination of didactic training and live co-therapy and supervision, or you can do 40 hours of face-to-face training with a PCIT Level 2 or Master Trainer that includes an overview of the theoretical foundations of PCIT, DPICS, coding practice, case observations, and coaching with families, with a focus on mastery of CDI and PDI skills and a review of the 2011 PCIT protocol.
During consultation training, the applicant must remain in contact via real-time consultation or video review with feedback with a certified PCIT trainer at least twice a month. The applicant must also serve as a therapist for a minimum of 2 PCI cases for graduation criteria, and at least one of the cases must be conducted with the applicant as the primary therapist.
A skill review is also required for PCIT training. Competence will be observed by a PCIT trainer in the following sessions conducted by the applicant: CDI teach, PDI teach, CDI coach, and PDI coach. Just as a quick recap, PDI stands for Parent-Directed Interaction, and CDI is Child-Directed Interaction. A PCIT trainer will review the sessions and determine whether the applicant has demonstrated mastery of each skill set. They also must be prepared to provide additional session observations as necessary to document adequate skill. As an additional note, applicants must have their treatment sessions observed by a certified PCIT trainer. Observations may be conducted in real time or through video recording. Level 1 trainers can only use video review after trainees have met the competencies in CDI and PDI.
Parent-child interaction therapy application process for certification.
It costs $225 to apply for PCIT certification. After the application is submitted, it will be assigned to a PCIT certification review. The reviewer then determines whether the applicant has met the minimal training guidelines, and the applicant should receive results of review within 2 weeks of submission.
So for successful applicants, they are assigned a username and a password to access the PCIT certification experience and exam. They take the exam and receive the results immediately. Within 5 days to 10 business days, the applicant recites the official notification of PCIT certification. Additionally, an applicant's name and contact information will be forwarded to the PCIT CEU office, and documentation of continuing education credit will be sent to the participant's home address.
So this information is for applicants that need more training. An applicant will not be permitted to take the PCIT certification exam. They will be given personalized feedback to further training they need, and the applicant will be refunded certification fee minus a $55 review fee.
The following slide will show a sample question of what to expect on the Parent-Child Interaction Therapy certification test.
The following is a sample question. During the 5-minute CDI coding period, Justina's daughter is drawing a cat. Justina says that that's one ugly cat. This should be coded as A, negative talk, B, neutral talk, C, behavioral descriptions, or D, no code. So the correct answer would be A, negative talk. A comment that contains a negatively evaluative word referring to an action, product, attribute, or choice of the child would be considered negative talk. Neutral talk would be incorrect as well, because it would have been coded if the mother had said, "That cat has purple eyes." Behavioral description is also incorrect, because it would have been coded if the mother had said, "You drew a cat." No code is also incorrect because it meets the criteria for A, negative talk.
The next couple slides are a case study to show that parent-child interaction therapy works. This slide covers the 5 W's of the case study. There's 43 families with children between the ages of 1.5 years to 4.5 years who displayed disruptive child behaviors. What was the parent-child interaction therapy? This study was done in Sydney, Australia, between the years of 2005 and 2006. The study was done to determine if therapy would decrease child behaviors, parental stress, parental psychopathology, and parental attitudes towards the therapy.
Results from this case study show that after an average of 11 family sessions, there were both clinically and statistically significant improvements seen in child behaviors and parental well-being, and parents reported high levels of satisfaction with treatment.
Want to learn more about parent-child interaction therapy? The links provided below are great resources if someone would like to learn more about PCIT or the therapy process. Thank you.